Welcome back to Biology 2210L at CNM AMP2 Lab. Today's topic is the cranial nerves. Now, this completes our discussion of the nervous system, and when we talk about cranial nerves, we're really picking up where we left off when we talked about spinal nerves. So many of the basic characteristics of spinal nerves are true of cranial nerves as well. It's just that instead of passing messages to and from the brain through the spinal cord, cranial nerves communicate with the brain directly. There are 12 pairs of cranial nerves arising from the base of the brain. Most these cranial nerves communicate directly with the brain stem. They exit or enter the cranium depending on whether you're talking about motor or sensory function. They enter or exit the cranium through foramina. And remember, back in early in the term, we learned various foramina openings in the skull. So we're going to refer you back to those foramina as we learn exactly which ones each cranial nerve passes through. The cranial nerves generally lead to muscles or glands in the head and neck region, or if they have sensory function, they lead from sensory organs, again located mainly in the head and neck region. There is one notable exception to this. Well, there's a couple of exceptions. The notable one, though, is the vagus nerve, which really wanders away from the head and neck region and provides innervation essentially throughout the ventral cavity. And in fact, the name vagus stems from the same word origin that gave rise to vagabond or vagrant, all of it having the sense of wandering. So the vagus nerve is the notable exception to that localization of innervation. Usually when we learn the anatomy of the cranial nerves, we learn them by looking at a photo or a model or a diagram of the base of the brain, highlighting the actual 12 pairs of cranial nerves. And so as we go through this, we will learn the names of each one of these cranial nerves that you see highlighted here, and we will also learn their function. Now, cranial nerves, like spinal nerves, can have motor and or sensory function. The motor fibers of cranial nerves begin in nuclei of the brainstem. And so remember, nuclei are patches of gray matter isolated in the white matter in the brainstem. The sensory fibers, as is typical of sensory components of nerves, begin in receptors out in the body, again mostly in the head and neck, and leading into the brainstem. Again, the exception to this is the vagus nerve, which has receptors throughout the ventral cavity. Most cranial nerves communicate with the body in an ipsilateral fashion. What that means is messages from the, say, right side of the body or to the right side of the body will come from or go into the right half of the brain. In other words, the messages stay on the same side. They do not tend to cross over to the other side. There is an exception to this, and that is the optic nerve. The optic nerve is very interesting in that half of its fibers cross over or decussate, which is the fancy word for cross over to the other side. Half of the fibers cross over, and half of the fibers stay in the same side. And so that's very interesting. What each half of the cerebrum is receiving is basically half an image from each retina, and the brain has to put that together to make sense out of it. And when we talk about the optic nerve, I will highlight exactly that pattern of decussation. The other nerve where we get crossing over or decussation is the trochlear nerve. This is primarily a motor nerve sending messages out to a muscle, and they tend to cross over to the contralateral side, meaning the opposite side. All right, now remember, with spinal nerves, we said all spinal nerves are mixed nerves carrying both motor and sensory messages. This is not completely true for the cranial nerves. With the cranial nerves, we do have a few cranial nerves that are completely sensory. And this slide shows you which nerves are which using the number convention, cranial nerve 1, 2, 3, etc. I tend not to use this numbering system because it doesn't provide you with much information. I generally refer to the nerves through their names. And so as we go, I will highlight for you which ones are sensory, which ones are motor, etc. I also have a summary at the end of this presentation that will come back and use the names of the nerves to refresh your memory as to which is sensory and so on. And so cranial nerves that are completely sensory are 3 of them, plus a couple of branches of what we call the trigeminal nerve could be added to this as well. The ones that are motor are, again, the most common group that are motor in function. Now, it really is unfair to talk about these nerves as completely motor in function. I refer to them as primarily motor in function because all of these nerves do have a small amount of sensory function in the context of proprioception. Remember, proprioception is awareness of muscle and joint position in the body so that we can have coordinated and balanced contraction and movements, and so that we are aware of our position in space. And all of these so-called motor cranial nerves do perform some proprioceptive sensory function as well. So it's more accurate to refer to these as primarily motor in function. And then we have 4 cranial nerves that are truly mixed in their function, meaning they have significant motor and sensory functions both. So these are much like spinal nerves that truly have a healthy mixture of motor and sensory function. All right, so at this point we're going to run through the nerves one by one. One last thing I neglected to mention before we start is that 4 of the cranial nerves are also going to have parasympathetic function. Remember, the parasympathetic system is part of the autonomic nervous system. It's the resting and digesting system. And a large part of the parasympathetic nervous system is 4 of the cranial nerves. That is the majority, really, of the parasympathetic nervous system. There are a couple of sacral nerves that exit from the sacrum that are also part of the parasympathetic nervous system, but the vast majority of parasympathetic signals are carried by 4 of the cranial nerves. And I, again, will highlight those as we go through them. And again, I have a summary at the end that will help put it all into one place for you. All right, so as we go through each of the nerves now, we are going to talk about where the nerve is, of course, what foramen it passes through, and generally, very generally, what the function of that nerve is. Again, I tend not to use the numbers. I tend to refer to the nerves by their names. And there are various mnemonics that students have learned over the years to help remember the order of these nerves. Probably the most classic one is on old Olympus's towering top, a Finn and German viewed some hops. And you may have heard that one before. We don't use that one anymore, partly because it's kind of dated, and most people don't think about Finns and Germans viewing fields of grain called hops and so on, and where was Olympus and so on. The other reason we don't use it, probably the better reason we don't use it, is that some of the names have slightly altered since that mnemonic, and it doesn't quite fit any longer. So one that I recommend to students at this point is OOO, to touch and feel very good velvet, ah heavenly. And again, most of these mnemonics sound silly when you say them, but they do give you an anchor point, which you can then think of in terms of memorizing the order of the 12 nerves. Of course, in a mnemonic, the first letter of each word in the mnemonic stands for the first letter of a nerve in the sequence. So O, to touch and feel very good velvet, ah, heavenly. Of course, we expect then the first three cranial nerves to begin with the letter O. And so when we get to the first one, no surprise, it is the olfactory nerve, and that is the first O in that mnemonic saying, and so on. All right, so when we talk about the olfactory nerve, we immediately begin with a little bit of confusion. Most students think that the olfactory nerve is this big nerve that they're seeing right here at the base of the brain. Actually, there are many olfactory nerves. They are tiny little nerves that exist in the nasal mucosa, and they pass up into the brain through the cribriform plate. So you remember the cribriform plate, that porous region of the ethmoid bone on either side of the crista galli. Now we understand why all those little holes were there, because all of our olfactory nerves are actually passing up through those holes. Those neurons in those olfactory nerves end up in this swollen region, which is known as the olfactory bulb. And in that swollen region, they synapse with a second set of neurons that are then going to carry the messages on to the brain. And so what we see coming out of the olfactory bulb is something known as the olfactory tract. The olfactory tract. And that helps us remember that the olfactory nerves are actually coursing through the cribriform plate, and the olfactory tract is really a second set of neurons that have picked up the signals and are carrying it up into the brain. Of course, the olfactory nerve is one of our purely sensory cranial nerves, and as the name implies, it conveys messages to the brain regarding smell. And here we see a cadaver photo of the nerves themselves, the olfactory nerves passing through the cribriform plate. Here we see the olfactory bulb just sitting on top of the cribriform plate on either side, and then the olfactory tract, which leads up into the brain. A view from below, again, we don't see the olfactory nerves from this view because they've been teased away as we pulled the brain out of the cranium, but we do see the olfactory bulb and the olfactory tract. All right, on to the second cranial nerve, another O word, which is, in this case, stands for the optic nerve. The optic nerve is another nerve that is completely sensory in function, and it passes, of course, through the optic canal of the brain to get into the optic canal of the skull to get into the brain. Of course, the sensory function of the optic nerve is to convey messages regarding sight or vision into the brain, and it all begins with that light-sensitive film on the back of the eyeball called the retina. And the retina actually has several layers of sensory neurons in it, but eventually those sensory neurons will converge into a nerve that passes out of the back of each eyeball called the optic nerve, again, which passes through the optic canal. Now, I mentioned earlier that this is one of the few cranial nerves that is at least partially contralateral in its innervation, meaning it partially crosses over. And again, it's an interesting pattern. Generally speaking, what happens is images that fall on this lateral side of the retina, tend to pass through the optic nerve and stay on the same side of the brain. And so that's true for both sides. So this lateral portion of the field of view of this left eye will go to the left brain. The lateral portion of what falls on the retina on the right side goes to the right side of the brain. However, the portions or the images that fall on the medial side of the retina, they will cross over to the other side of the brain. And the same is true for the other eyeball as well. It will cross over. The medial image will cross over. So what each occipital lobe ultimately receives is, again, an interesting, confused kind of picture. It receives the lateral view from its side of the retina and the medial view from the opposite retina. And the occipital lobe somehow has to put that together to make a complete and coherent image in the brain. This emphasizes the need for the two hemispheres of the brain to work together, because it would be very confusing if each was generating a separate image. And of course, if you close one eye, you still have a complete image. And so the brain very quickly knows how to go back and forth between putting together images coming from both eyes versus just focusing on an image coming from one eye. Again, a remarkable feat of integration or processing taking place in the cerebrum. The fact that there is this ability to cross over at least some of the sensory signals means that there has to be a physical location where the optic nerves cross over, and we see this very characteristic X pattern here where at least some of the fibers cross over. This is referred to as the optic chiasma or optic chiasm. Remember, chi is the Greek letter that is most often represented as an X. So once again, this X-like shape is being referred to by the Greek letter chi. So optic chiasma. And what comes out of the optic chiasm and continues on to the brain is technically not called the optic nerve anymore. From that point on, it's technically referred to as the optic tract. All right, so it's optic nerve distal to the optic chiasm, but it's the optic tract proximal to the optic chiasm. Finally, for this nerve, I want to point out the very close proximity of the optic chiasm to the pituitary gland, which sits in the cella turcica. And I may have mentioned this before, but in some cases where people have to have surgery on the pituitary gland, sometimes, for instance, they have too much growth hormone resulting in gigantism, which can be life-threatening. Generally speaking, the best way to access the pituitary gland is through the nasal cavity, to drill up through the nasal cavity to access the pituitary gland. And there's a danger in this surgery because of this close proximity. And patients who elect to have this surgery are always cautioned that a possible side effect is blindness because of the trauma to this general region, or potentially the possibility of actually severing the nerve by mistake. Here we see a photograph again from the floor of the bottom of a cadaver brain. We see the optic nerve on each side entering the optic chiasma, which is the point where the X occurs, and then optic tracts continuing on to the brain. Another view of the optic nerve in various images. All right, the third cranial nerve is another O, as the mnemonic would indicate, and this is known as the oculomotor nerve. The oculomotor nerve. The oculomotor nerve is primarily a motor nerve. The oculomotor nerve is one of those nerves that is primarily motor in function. So what it does is it sends messages out to the muscles that control eyeball movement in the eye socket. Now there are, let's count one. There are 6 muscles altogether that move the eyeball around in the eye socket, and the oculomotor nerve sends messages to 4 of those 6 muscles. Now, we haven't done the eyeball, so we're not familiar with the names of these 6 muscles, so we're not going to bother with trying to name them. We'll just say that the oculomotor nerve serves 4 of the 6 muscles that move the eyeball around in, again, in the orbit in the eye socket. The oculomotor nerve is also one of the 4 parasympathetic nerves of the body. One of the, I shouldn't say of the body, one of the 4 parasympathetic cranial nerves of the body. In terms of its parasympathetic, and remember, by the way, both sympathetic and parasympathetic divisions are motor divisions. There is no such thing as autonomic sensation. So when we're talking about the parasympathetic system, we're only talking about motor messages going out to the body. The oculomotor nerve's parasympathetic function is it sends messages to another part of the eye that we haven't learned about called the ciliary muscle. And this is responsible, the ciliary muscle or ciliary body is what we use to change the thickness of the lens inside the eyeball when we focus. So our ability to change the thickness of our lens and focus on near objects and then thin the lens out and focus on objects that are farther away, that depends on the parasympathetic activity of the oculomotor nerve on what is called the ciliary muscle or the ciliary body. The oculomotor nerve also innervates the muscles of the iris, the colored, the pigmented portion of the eye. And of course, the iris does consist of pigmented smooth muscle tissue, and the parasympathetic system is responsible for constriction of the pupil specifically. So when there's too much light and we want to reduce how much light is going into the retina, so we don't overexpose the retina, we constrict the pupil. The pupil is the dark spot at the center of the pigmented part of the eye. It's not a structure, it's a hole that allows light into the eyeball and onto the retina. And so to reduce that amount of light, when we have too much light, we constrict the pupils, and we do that by stimulating smooth muscle in the iris, the pigmented part of the eye. And again, this is a parasympathetic function. By the way, dilation of the pupil, the opposite, is carried out by the sympathetic nervous system, and that does not involve a cranial nerve. Okay, so that's the oculomotor nerve. How does it get from the brainstem out to the eye socket? It passes through a foramen that we learned, or an opening that we learned before, which is the superior orbital fissure. And here again we see a picture of the oculomotor nerve. So we've got the olfactory, the optic nerves, and then coming right off the top of the pons is where we see the oculomotor nerve, right at the top of the pons. All right, the next nerve begins with a T in our mnemonic, and so it is the trochlear nerve. The trochlear nerve is also a primarily motor nerve, and it's very limited in function. It's very interesting. It serves one muscle of the body, and that is one of the 6 muscles that moves the eyeball around in the eye socket. So the oculomotor served 4 of them. This extra one, this one extra, we have 2 more to go, obviously. So one of the 2 that we haven't innervated yet is going to be served by the trochlear nerve. Specifically, it serves a muscle referred to as the superior oblique muscle. And again, if you learn eye anatomy, you will learn the 6 muscles of the eyeball. This is a muscle that cuts across the top of the eyeball. So we've got rectus muscles that go straight out to the eyeball that move it in logical fashion, up, sideways, down, so on. We've got 2 oblique muscles that cut across the eyeball that help rotate it a little bit in position. And so the oblique muscle tends to rotate the eyeball and tends to pull it down and in, or down and out. At any rate, the reason we call this the trochlear nerve is because this, and the only reason I'm really mentioning the name of this muscle is because the superior oblique muscle does something interesting. It originates in the back of the eye socket and comes up and passes through a little loop and then cuts across the top of the eyeball. So it starts like the rectus muscles just coming straight from the back, but instead of attaching directly to the eyeball, it passes through a loop and then cuts across the top of the eyeball. That loop is referred to as a trochlea. Remember, a trochlea is a name for a pulley-like structure. And so because this nerve serves a muscle that passes through a trochlea, a pulley-like arrangement, we refer to it as the trochlear nerve. And that's really it for the function of the trochlear nerve. It serves one muscle of the 6 that move the eyeball around. The trochlear nerve, like the oculomotor nerve, passes once again through the superior orbital fissure. And here we see on the base of the brain the trochlear nerve. Remember, this was the oculomotor nerve coming off at the top of the pons. The trochlear nerve is a very tiny nerve that comes off the side of the pons, kind of nestled way back, hidden underneath that occipital lobe, or I should say temporal lobe, of the cerebrum. So 2 little nerves coming from fairly deep down on the side of the pons. The next nerve is one of the most complicated of the cranial nerves. It is known as the trigeminal nerve. It is the largest cranial nerve in diameter. It is not the largest cranial nerve in terms of extent of innervation. That's going to be the vagus nerve again that wanders throughout the ventral cavity. But in terms of sheer size, diameter, it is the largest cranial nerve. And that's probably because it really is 3 nerves in one. The trigeminal nerve has 3 separate branches or divisions known as the ophthalmic division, the maxillary division, and the mandibular division. The trigeminal nerve is primarily a sensory nerve, and you can see 2 of its 3 divisions are purely sensory. The ophthalmic division is purely sensory. The maxillary division is purely sensory. The mandibular division, on the other hand, is a mixed nerve carrying both motor and sensory fibers. The trigeminal nerve is the primary sensory nerve of the face. So generally speaking, when we feel things with the face, hot, cold, touch, things like that, pain, that is coming in through the trigeminal nerve. The one sensation that is notably not carried by the trigeminal nerve is taste. Our sensation of taste is going to be carried by a couple of other cranial nerves. But other than that, it is the primary sensory nerve of the face. The trigeminal nerve is notoriously sensitive, and this is the reason, for instance, why toothaches are so painful and tooth abscesses are so very painful. The trigeminal nerve is essentially a very, very delicate, sensitive nerve. There is a condition known as tic douloureux. That's a French name. It's hypersensitivity of the trigeminal nerve. And so for people with tic douloureux, the trigeminal nerve is so sensitive that even a small breeze crossing the face will cause excruciating pain. And in some cases, the pain is so bad that patients will choose to have the nerve cut rather and just not feel, rather than endure the pain associated with the trigeminal nerve. So it is a very sensitive nerve. All right, as we said, it has 3 divisions: an ophthalmic division, a maxillary division, and a mandibular division. In terms of their sensory function, you can see on this diagram here that the ophthalmic division pretty much serves the upper part of the head, so the crown of the head, the forehead, the nose, eye region. Again, sensation, touch, feeling in all these places. The maxillary division serves this part of the head, basically the anterior part of the temporal region, the cheeks, upper lip, and most notably upper jaw. So when a dentist has to work on your upper teeth, he or she must anesthetize the maxillary branch of the trigeminal nerve. And then the mandibular division, of course, serves, as you might guess, the lower lip, the chin, the lower jaw, etc. It also extends and radiates and does some sensation of the skin above the ear. And again, when a dentist works on your lower teeth, he or she must anesthetize the mandibular division. And so, again, this is the primary sensory nerve of the face. We did say that the mandibular division is a mixed nerve, and so it does have some motor function. And you can see here what the motor functions are for the mandibular division. It serves various muscles, primarily associated with chewing. Now, we learned one of these muscles, the masseter muscle, but there are other muscles also involved in chewing, and it serves primarily all of those muscles associated with chewing. So that is its motor, that is the motor function of the mandibular division. Now, each of the three branches or divisions passes through a different foramen to get through the skull. The ophthalmic division passes once again through the superior orbital fissure. So we're seeing that the superior orbital fissure is a very important opening through which many of these cranial nerves pass already. The maxillary division of the trigeminal nerve passes through a foramen we learned, the foramen rotundum, and then again courses forward onto the cheek and upper jaw. And then finally, the mandibular division passes through the foramen ovale and the floor of the cranium, and then down to the jaw. Okay, so that is the trigeminal nerve. On a cadaver or on the base of a brain, it is fairly obvious because of its size. So remember, we had the optic nerve here, the oculomotor nerve at the top of the pons, the tiny little trochlear nerve here, and now we have to come off to the side of the pons. We look for the biggest nerve coming off the side of the pons, and that's going to be your trigeminal nerve. Again, recall that the trigeminal nerve then branches into its three divisions, and so each of those three divisions is highlighted here. Again, the ophthalmic division for the forehead and eye and nose region, maxillary division for the upper jaw and cheeks, and mandibular division for the mandible, and then don't forget part that goes up above the ear as well. All right, the next nerve on the list in order is the abducens nerve. The abducens nerve. The abducens nerve is another primarily motor nerve, and it's very much like the trochlear nerve in that it serves a single muscle in the body. And again, this is one of the muscles that moves the eyeball around in the eye socket. And so we said there were 6 muscles altogether. The oculomotor nerve served 4 of them. The trochlear nerve served 1 of them. And so the one remaining muscle of the 6 is served by the abducens nerve. The abducens nerve once again passes through the superior orbital fissure, heads out into the eye socket, and serves a muscle known as the lateral rectus muscle. This is this straight muscle that attaches to the outside of the eyeball. I mention this in this specific case because knowing this helps you appreciate the name abducens nerve. If you can visualize what happens when this muscle contracts, it's going to shorten and pull on the outside of the eyeball, causing your eyeball to move laterally. So this is the muscle you use when you look to the side with one of your eyeballs. If you think about what kind of movement that is, that would technically be referred to as abduction of the eye, because we're rotating or moving the eye away from the midline. So since this nerve serves the muscle that abducts the eye, we call this nerve the abducens nerve for abduction. It's interesting to note that we can't send signals through both abducens nerves, both right and left abducens nerves, at the same time. Because if we did, that would tend to draw both eyes laterally, and then we would lose our three-dimensional vision, our depth perception. the reason humans and other arboreal creatures and predators tend to have eyes facing forward is that we like to have both eyes focusing on the same image. This allows us to triangulate distance. This is what gives us depth perception. Organisms with eyes that point out to the side, of course, don't have that ability. They're adapted to a maximum field of view, but they technically don't have depth perception. And so there's really no need for us to abduct both eyes at the same time. It's just not how our brain is wired in terms of trying to get depth perception. We can, if you think about it, adduct both eyes at the same time. That would be, of course, going cross-eyed. Because as an object gets closer and closer to our face, we do need to draw the eyeballs together to maintain that focus on that image and to be able to triangulate. And so our innervation and how we can move our eyes is designed to work with this need or desire to maintain three-dimensional vision, depth perception. The abducens nerve, as you can see, comes off the base of the pons, essentially just where the pons and the medulla meet. So up close, you usually see two nerves coming off right at this boundary between pons and medulla. That's the abducens nerve. At this point, we're halfway through the cranial nerves. And so the rest of the cranial nerves you can see are really going to be associated primarily with the medulla down here. The next nerve is the facial nerve. The facial nerve is a truly mixed nerve. The facial nerve is a truly mixed nerve. I would say it's mostly motor in its function, but it does have at least one significant sensory function as well. The motor aspects of the facial nerve are that it is the major motor nerve for your facial muscles. And so facial expressions are modulated through this facial nerve. The facial nerve is the second cranial nerve that also has some parasympathetic motor function. Its parasympathetic motor function is to stimulate salivation in our salivary glands and to stimulate fluid production by our lacrimal glands, our tear glands, glands in the nasal mucosa, and glands on the palate to release fluids from these glands. And so that's its parasympathetic function. Now, I did say it had one significant sensory function, and its sensory function is taste. Remember, we said that the one sensation that the trigeminal nerve didn't perform was taste. And we said that that was going to be performed by two other cranial nerves. Well, the facial nerve is one of the two cranial nerves that are involved in our sensation of taste. Specifically, the facial nerve accounts for taste on the anterior 2/3 of the tongue. So it doesn't innervate the entire tongue, just the anterior 2/3. So there's going to be another cranial nerve that's going to carry out taste on that remaining posterior third, which we will see in short order. The facial nerve takes a circuitous route to get out of the skull. It initially passes through the internal acoustic meatus, heading towards the ear, but it then passes through the middle ear chamber. The middle ear chamber is just behind the eardrum where the three ossicles are located, the malleus, incus, and stapes, those tiny vibrating bones that convey vibrations from the eardrum into the inner ear where they're sensed. The facial nerve passes through that cavity, that middle ear chamber, and then continues on through the skull and actually passes out through a small hole just below the ear. And from there, it then spreads out across the face. If we damage the facial nerve, it leads, of course, to a paralysis of facial muscles. So you get sagging appearance of the face, and of course, a disrupted sense of taste. Here we see the facial nerve after it's gone through its circuitous route through the middle ear chamber, again passing out through a tiny opening below the ear, and then it quickly starts to radiate out. And you can see, again, serving all portions of the face for facial expression, and again also serving in its parasympathetic function, serving some of the salivary glands, tear glands, etc. Here we see it on a cadaver, again, how it passes out and then radiates out across the face. Looking carefully at the facial nerve, again, remember the abducens nerve is coming off between the pons and medulla here, and so as we move down the medulla from there towards the side, the first major nerve we encounter is going to be the facial nerve. There are 5 named branches of the facial nerve, just like there were 3 named branches of the trigeminal nerve, but that's not on our list of terms, so we're not going to worry about that. The next nerve is the vestibulocochlear nerve. This nerve has gone through some name changes over the years. Originally, it was called the auditory or acoustic nerve. Then the name was changed to statacoustic nerve to recognize its role in equilibrium, not just hearing. And now finally we seem to have settled on vestibulocochlear nerve. The vestibulocochlear nerve is the last of our purely sensory cranial nerves, and it is involved in 2 different kinds of sensation. It is involved in hearing, and it is involved in equilibrium or balance. And so the inner ear, again, the inner ear is involved in both those senses. Essentially what happens is sound waves come in, vibrate your eardrum. Those vibrations are passed through the ossicles, again, these little ear bones, causing a membranous window to shake. That causes a vibration to pass through fluid. That fluid vibration passes through this snail-shaped tube, and again in a somewhat complicated fashion by causing membranes in the tube to vibrate. That stimulates hair cells, and that is hearing. And originally that's all we really thought about the ear, and then we realized that there's a whole other portion to the inner ear. This, by the way, is that middle ear chamber that I was talking about that the facial nerve passes through before it continues on out of the body. But this other portion of the inner ear, called the vestibule, is involved in balance. And again, we have a fluid inside here, and as our heads move side to side, forward and back, maybe spin around as our bodies spin, the fluid inside the vestibule is going to slosh around, and it's going to slosh up and around through these various oriented semicircular canals. And to make a long story short, that sloshing of the fluid, like water in a bucket, is going to cause, again, some bending of hair cells. But this time, that's not going to be sensed as hearing, but in this location, the brain senses the bending of hair cells as movement, either rotational movement, like in spinning, or acceleration and linear acceleration and deceleration. So this is an important component of balance in our system. So purely sensory, sensing both equilibrium and hearing. And of course it has 2 separate branches, a branch that comes from the vestibule that's involved in balance, and a branch that is serving the cochlea, which is what we call the part that is involved in hearing. Cochlea means is reminiscent of a conch or snail shell because of its appearance. So they fuse together and travel into the brain as the vestibulocochlear nerve. Once again, as you might expect, this passes through the internal acoustic meatus to get into the brain. And here we see a close-up of the vestibulocochlear nerve. It is usually very close, essentially right next to the facial nerve that we just talked about, because they both go out the internal acoustic meatus. And so sitting side by side are the facial and vestibulocochlear nerves. Just remember that the facial comes first, and then the vestibulocochlear comes just after it as we move down the brainstem. The next one on our list is the glossopharyngeal nerve. The glossopharyngeal nerve. The glossopharyngeal nerve is a mixed nerve. The glossopharyngeal nerve is a mixed nerve, though like the facial nerve, it is primarily motor. So the glossopharyngeal nerve will pass out of the brain through the jugular foramen. Remember, the second largest foramen after the foramen magnum, and it will then spread out and essentially, as you can see, provide motor innervation to muscles of the tongue and throat. Hence the name glosso, which means tongue, and pharyngeal, which means throat, pharynx. So innervates the tongue for movement of the tongue, for speech and swallowing, things like that, and muscles of the pharynx involved again in swallowing. The glossopharyngeal is the third nerve that has parasympathetic function. Remember, there were 4 cranial nerves with parasympathetic function. So far, we've seen the oculomotor and the facial nerve had parasympathetic function. Now we see the glossopharyngeal nerve as the third of the 4 parasympathetic cranial nerves. The glossopharyngeal's parasympathetic function is that it will innervate the parotid salivary gland. The parotid salivary gland. So while the facial nerve innervates most of the salivary glands, the glossopharyngeal will innervate the largest of the salivary glands, called the parotid salivary gland. Now, I did mention that it's a mixed nerve. It does have some sensory function. Most notably, the glossopharyngeal nerve is that other nerve that is involved in taste. So remember, we said the facial nerve sensed taste on the anterior 2/3 of the tongue. The glossopharyngeal nerve senses taste on the posterior third of the tongue. Another sensory function of the glossopharyngeal nerve is it actually receives messages from the carotid sinus. This is a enlarged region of the carotid artery, which is the major artery that serves the brain, supplies the brain with blood. And we have baroreceptors in the carotid sinus that sense stretch, essentially sensing blood pressure. And so the glossopharyngeal nerve is important in the body's reflexive control of blood pressure, because it's one of the main ways we sense blood pressure in the body is by stretch in the wall of the carotid artery. So a very important nerve serving a variety of functions, right? Tongue movements for speech and food movement, etc. Muscles of swallowing, sensation of taste, a large component of salivation, and blood pressure sensation. So a lot going on with this small glossopharyngeal nerve that again passes through the jugular foramen. Here we see the floor of the brain again, or the bottom of the brain again, and again, remember where we were. We have these two very close nerves close together. So again, the abducens nerve here at the base of the pons, and then as we slide down, we had the facial and vestibulocochlear nerve right next to each other, sort of like a pair. And then we see, as we move further down or farther down the medulla, another pair of nerves sitting very close together. The glossopharyngeal is this tiny one. The next one is going to be a very large nerve. So the glossopharyngeal is the tiny one of these two that tend to sit side by side. Again, coming off, once again, the side of the medulla. The 10th cranial nerve is the vagus nerve, And while it's not the biggest in terms of size, diameter, it is the most extensive. So it is the longest cranial nerve, and it extends, as I said, not just through the head and neck region, but throughout the ventral cavity. And so the vagus nerve is the principal parasympathetic nerve of the body. It is a mixed nerve. It does perform sensory functions for most of the organs that it innervates as well. But in terms of its motor function, it is the major parasympathetic nerve of the body. 85 to 90% of the parasympathetic system is in this one nerve, the vagus nerve. And so it sends parasympathetic messages. Again, remember, parasympathetic means resting and digesting system, all over. So it has effects on heart function. It has effect on ventilation and pulmonary function. It is the main nerve that stimulates digestive function. It stimulates urinary function. It's involved in swallowing and speech, sort of parasympathetic regulation of those activities. So a very fundamentally important nerve of the parasympathetic nervous system. Like the glossopharyngeal nerve, the vagus nerve passes through the jugular foramen and then wanders throughout the body. So here we see a diagram again of the vagus nerve as it extends out through the jugular foramen. Immediately starts branching to serve some of the pharyngeal muscles involved in speech and swallowing. It does have some sensory nerves. Again, it tends to have sensory fibers from all of these organs as well. So with the glossopharyngeal nerve also sensing blood pressure in the carotid body. And then travels down the neck and serves, as we said, all these visceral organs in the ventral cavity. Because the vagus nerve passes through the neck, if you massage or palpate the neck too vigorously, you can actually physically stimulate the vagus nerve. And the effect of the parasympathetic nervous system on the heart is to slow it down. And so you want to be careful with over-massaging the neck region, because you don't want to overstimulate the vagus nerve and inhibit or slow down the heart too much, especially in individuals who already have some kind of heart insufficiency. Here we see various views of the vagus nerve on a cadaver. Looking here, comes off of the medulla just behind the glossopharyngeal. So again, we have facial and vestibulocochlear as a pair. Now just down on the medulla, we have glossopharyngeal and vagus as a pair of nerves that are very close to one another. The difference, of course, is position and size. And as I mentioned, of course, the vagus nerve comes down the neck region, not too deep, fairly superficial, so again, easy to stimulate directly by rubbing on the neck. All right, only two cranial nerves left. The next one is called the accessory nerve. Some people refer to it as the spinal accessory nerve. This one is interesting. This one is different from the other cranial nerves, and I would not be surprised, this is just a guess, but I would not be surprised if someday this nerve gets removed as a cranial nerve, because in reality it is more like a spinal nerve than a cranial nerve. And so it may indeed get removed as a cranial nerve someday, but for now it's still considered a cranial nerve. So as I describe it, you'll, I think, understand why I say it's not really a cranial nerve, or it's very different from the other cranial nerves. The spinal accessory nerve is primarily a motor nerve. It's primarily a motor nerve, and like spinal nerves, it serves primarily skeletal muscles. Specifically, it serves two skeletal muscles of the neck and trunk, the sternocleidomastoid muscle and the trapezius muscle. So this is very different, first of all, because unlike the other cranial nerves, it's not serving completely local tissues up in the head and neck, obviously extending down to a trunk muscle. And again, the vagus is the only other cranial nerve that really moves away from the head and neck region. So it's different there. It's serving skeletal muscles that we conventionally would think would be served by spinal nerves. And in fact, as I mentioned, really they are, because what happens with the spinal accessory nerve or the accessory nerve is that its fibers begin as branches off of your cervical spinal nerves. Remember, the cervical nerves get involved in a plexus. And so some of their fibers fuse together to form this accessory nerve, which is actually, as you can see, originating from the spinal cord. So it really is a spinal nerve. But what it does, very interestingly, is it passes up through the foramen magnum into the cranium. And then it does an immediate U-turn and comes back out through the jugular foramen along with the vagus nerve, passes out of the jugular foramen, and then goes on to the sternocleidomastoid and trapezius muscle. So it's called a cranial nerve because it comes out of the jugular foramen to get to its effector muscles. But in terms of its origin, it does not originate in the brain. It originates in the spinal cord like a typical spinal nerve. It just happens to pass up into the cranium through the foramen magnum and then back out again. So just by virtue of this little U-turn and detour it takes, we call it a cranial nerve. But in all other aspects, it really is a spinal nerve. And like most spinal nerves, it is a mixed nerve innervating skeletal muscles of the body. Primarily motor, again, the mixed portion is for proprioception again. All right, so that's the very unusual accessory nerve. When we look at it on the bottom of the brain, of course, we see that unlike the other cranial nerves, it is originating really below the medulla on the sides of the spinal cord, and then passing up into the cranium and then passing out through the jugular foramen again. So it's got this weird shape to it where you see many little branches coming off the spinal cord to create it. And then our final cranial nerve is the hypoglossal nerve. The hypoglossal nerve. The hypoglossal nerve is another primarily motor nerve. It does have some proprioceptive sensory function, but is a primarily motor nerve. It passes, as you might guess, through the hypoglossal canal of the skull just above the occipital condyles. It travels down to the mandible, and here you see it is going to provide innervation motor signals essentially to the muscles of the tongue and various muscles beneath the tongue. And these are referred to as extrinsic muscles of the tongue. So you've got the intrinsic muscle of the tongue itself and the various extrinsic muscles below the tongue that are associated with moving the tongue around. So the hypoglossal nerve is almost exclusively associated or devoted to the tongue movement. And again, so it gets involved in speech, food manipulation, initiation of swallowing, and so on. In terms of our, again, view from the bottom of the brain, we see that the hypoglossal nerve is a little bit different from the other ones. Remember, back here we had the glossopharyngeal and vagus nerve side by side, then the spinal accessory. The hypoglossal nerve doesn't continue down. The pattern so far has been going down, 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 down towards the spinal cord. For the hypoglossal nerve, we come back up from the spinal accessory nerve. And it's just anterior. It's in front of all these other nerves that we've been talking about. So essentially, in front of the vagus, anterior to the vagus on the medulla, is where you expect to find the hypoglossal nerve. And again, it passes out through the hypoglossal canal. All right, so your PowerPoint that you have provided you, this is chapter 14, if you haven't noticed by now, has a nice summary diagram, again, of the brain and all the various parts that the 12 cranial nerves serve. I have also provided in CNM Learn a couple of documents listed under additional images. So if you open the additional images folder, you'll see in there Remember, there was a spinal nerve package where we looked at all the spinal nerves. The last 2 pages of that spinal nerve package have diagrams of the cranial nerves. And I've also included a document called Cranial Nerve Summary. And in that document, as promised, I summarize, again, things like which nerves are parasympathetic, what foramina the cranial nerves pass through, which ones are purely sensory, which ones are mixed, etc. So what you'll find when you look at that cranial nerve summary is the following. First, you will find a list of which of the nerves are parasympathetic, the 4 parasympathetic nerves, and what their parasympathetic function is. You will also find a list of the nerves showing which foramina they pass through, just summarizing, again, everything I've talked about today. This completes the list of foramina that the nerves pass through. On that cranial nerve summary document, you will also again see which of the cranial nerves are purely sensory in function. And this includes the ophthalmic and maxillary branches of the trigeminal. Remember, the mandibular branch is mixed. You will find which of the cranial nerves are primarily motor in function. Remember, they all do have some proprioceptive function, but these ones are primarily motor, as we said. And then finally, which of the cranial nerves are truly mixed. Again, that would be the mandibular branch of the trigeminal and these 3 nerves. Then, as I said, in my spinal nerve and cranial nerve packet, you will see my diagrams of the cranial nerves. And so you have this diagram, which I think is a very nice, clear diagram showing the cranial nerves. Again, just to review, olfactory tract first, optic nerves associated with the optic chiasma, the trochlear nerve at the top of the pons, the oculomotor nerve, at the top of the pons, the trochlear nerve coming off deep from the side of the pons, the abducens at the base of the pons, between pons and medulla, and then after the abducens, this pair together, the facial and the vestibulocochlear side by side, and then another side by side pair, the glossopharyngeal and the vagus, coming up from the spinal cord, of course, the spinal accessory nerve, and then finally in front of the vagus on the medulla, the hypoglossal. So you just want to be able to run through that and recognize, for practical purposes, how to identify these on the bottom of a brain model. And then a final diagram, again showing essentially the same things that we just showed, but also showing a view of the floor of the cranium to remind you of which foramina these cranial nerves pass through. All right, so that completes our discussion of the cranial nerves. There is, as usual, a second video. Again, it will be very short, and it will simply be our brain model, and I will show you each of these cranial nerves on the bottom of our actual brain model. So do check that one out, and until then, I will see you, and take care and be safe.